China's medical researchers recently concluded from a follow-up study that 76% of hospitalized COVID-19 patients still have lingering symptoms such as fatigue, muscle weakness, sleep difficulties, anxiety and depression 6 months after contracting the disease. The clinical research was published in medical journal The Lancet on January the 9th. A total of 1,733 hospitalized COVID-19 patients discharged from Wuhan's Jinyintan Hospital between January the 7th and May the 29th last year were included in the study. The average age was 57. Gender ratio was 52% male and 48% female. Around 76% of patients reported persistent symptoms. The most common lasting problem was fatigue or muscle weakness, reported by 63% of all patients. Sleep difficulties came next, reported by 26%. Around 23% more female than male reported anxiety or depression. The researchers also believe that recovered patients risk being infected again. Wuhan resident Ms. Zhang and her husband both contracted the CCP virus in February last year. Zhang told the Epoch Times that she's still experiencing various symptoms as of today, including chest tightness, muscle aches, and insomnia.
We are getting old, and we don't do much physical activity. I have trouble sleeping, and I have to take sleeping pills. As for my husband, he has antibodies, as shown on the medical report when he was discharged from the hospital. I don't have antibodies. Actually, when I was admitted to the hospital, my test result was negative. I had symptoms of high fever and bad cough. My child said it must be lung problems, and he sent me to the hospital.
Ms. Zhang's husband is a confirmed COVID-19 patient. He had a fever but had to wait over 10 days to get a hospital bed. He's still suffering from muscle aches and memory deterioration. Sean Lin, a virology expert in Washington, D.C., pointed out that because the most prominent symptoms of COVID-19 are respiratory symptoms, most consider it a respiratory disease. However, he is not surprised at all that a variety of symptoms were reported by patients.
Receptors and auxiliary receptors for this virus are present in different organs and tissues. As a result, the novel coronavirus is capable of infecting several different organs. For instance, some patients have kidney and liver damages. There are also cases of heart problems. There are people who died from multiple organ failures. All these situations exist in real life.
An article published by the BBC in July last year entitled How COVID-19 Can Damage the Brain revealed that more than 300 studies from around the world have found a prevalence of neurological abnormalities in COVID-19 patients, including mild symptoms like headaches, loss of smell and tingling sensations, up to more severe outcomes such as aphasia, the inability to speak, strokes and seizures. In addition, the disease can wreak havoc on the kidneys, liver, heart and just about every organ system in the body. The BBC report cited Julie Helms, MD and PhD, from Strasbourg University Hospital in France, who reported widespread neurological symptoms among COVID-19 patients admitted to the intensive care unit, ICU, on top of breathing difficulties. They were extremely agitated and many had neurological problems, mainly confusion and delirium, Helms said, adding that some patients were very young, in their 30s and 40s, even an 18-year-old. This was completely abnormal. It has been very scary, she said. In November 2020, scientists at the University of Oxford conducted a study on a large number of COVID-19 survivors in the United States by analysing their clinical data. They found that 1 in 5 patients developed mental illness within 3 months. These patients had a first-time diagnosis of anxiety, depression or insomnia, and the ratio of 1 in 5 was about twice as likely as for other groups of patients in the same period. Renowned Chinese medicine doctor Hu Neiwen, who lives in Taipei City, Taiwan, analysed the disease from the perspective of traditional Chinese medicine.
在中医的讲法的话呢，这个时候就必须要用非常 Traditional Chinese medicine believes that very strong medicines must be applied to treat this disease. These medicines should be warm and nourishing in nature. For instance, if it is the kidney health that needs to be restored for a particular patient, we need a strong medicine to the point that we are directing almost all of his vigor and essence to his kidney to quickly improve the condition of the kidney. Same goes true for the treatment of heart problems. We need strong medicine, warm and strong, targeting the heart.
Doctor Who said, most COVID-19 patients are already very weak and need emergent treatment. Otherwise, the patient will be ruined. He also pointed out that presently Western medicine does not have an effective cure for the disease. The CCP virus pandemic has so far caused more than 90 million infections and nearly 2 million deaths worldwide. Now, new variants that spread more easily have been found in at least 10 countries, making it even more difficult to curb the spread of the virus. Due to the new restrictions on social media, our channel may be affected. If you'd like to stay tuned to our channel and receive notifications and updates, please provide us with your email by clicking the link below. Thank you for your support.